Hi everyone, I am Dr. S.P. Pradhan and welcome to my channel Dr. Pradhan Health Tips. Today I will be discussing about Down syndrome. Down syndrome is a chromosomal disorder. It is due to trisomy 21. That means one extra piece of chromosome present at the position 21. Normally there are 23 pairs of chromosome, and when there is an extra piece of chromosome at position 21, it causes Down syndrome. So, what are the features of Down syndrome? In case of Down syndrome, it causes mongoloid facies. The head is short and broad. There is shortness of neck, short ears, depression of nasal bridge, and there is upward slanting of the palpebral fissure or upward slanting of the eyes. And there may be protruded tongue, umbilical hernia may be present. So coming to the systemic features, almost all the systems get involved in Down syndrome. In case of cardiovascular system, the most common defect is endocardial cushion defect. Endocardial cushion defect or atrioventricular canal defect causes mixing of the oxygenated with the deoxygenated blood, causing hypoxia, and it may result in growth failure. Another defect is ventricular septal defect, and in case of gastrointestinal system, it may cause duodenal atresia, ileal atresia, Hirschsprung's disease. It may also cause hypothyroidism. That means the thyroid function is below normal, and it may cause mental retardation or seizures. In case of blood dyscrasia, it may cause leukemia or the blood cancer. So, how will you manage a case of Down syndrome? The life expectancy was 9 years in 1929. Now, the life expectancy of a Down syndrome child is 60 years as of now. It is due to change in lifestyle and progression in medical science. So, what are the lifestyle changes we should do in case of a Down syndrome child? First of all, we have to make a contact with a Down syndrome child. We have to speak in a very simple language. There should be no jargon speech. We have to make eye to eye contact, and a Down syndrome baby should feel relaxed in a very comfortable environment. If possible, show some visual aids so there will be better retention, and we should involve them in some mind developing exercises and mind developing games. We should do a combination of therapies like physiotherapy, behavioral therapy, occupational therapy, and speech therapy. The scholastic performance or the mental ability of a Down syndrome baby is very low. So we have to do a combination of all these therapies to get a maximum result. So, what is the importance of physiotherapy in case of Down syndrome baby? Normally, Down syndrome babies are having hypotonia. Tone means partial state of contraction of muscle, and the hypotonia causes gait disturbances and mobility problems. So, we have to do some physical exercise to increase the tone of the muscle. Now, the question is whether we can know about the Down syndrome during the time of pregnancy. There are some prenatal tests available like triple test or quadruple test so that they can have some early impression regarding Down syndrome. And this is all about Down syndrome. Hopefully you like this video. Thank you so much.